my name is Kat. I've been a nurse for 4 years.
Hi, my name's Courtney. I've been a nurse for 4 years.
Hi, my name is Donnie. I've been a nurse for 14-ish years.
Hi, I'm Michelle Stevenson. I've been a nurse for 9 years.
And today we're gonna play Never Have I Ever.
Never have I ever moved a patient to later down the wait list because they were rude.
I haven't made them wait, but I'll tell the doctor like, hey, can you see them last? So that wasn't necessarily making them wait. It was just like the doctor doing me a favor.
I work in the ER and we have, in the beginning it's called triage. That's where you check in. Oftentimes there's always a wait, but it always helps to be nice. It doesn't help to be rude. I'm gonna help the person that's gonna be nicer versus the person that's gonna be rude.
If you're nice and funny, oh my God, I will treat you with kisses and like maybe a sponge bath. Like, I don't know. Never have I ever gone on a date with a patient.
Bro, I have not. I'm single, so if I see like anyone in their 30s male and you're like, okay, are they gonna be hot? And then they're in the ER, it's not an appropriate time to be like, hey, are you single? Oh, you're here for diarrhea.
But I wanted to their son.
Oh my gosh.
And it was a hospice patient.
Oh, that's bad, that's bad.
Like, it was hard because I had to be like, your mom's dying. And in my mind I was like, but I want to take you to the movies.
I used to work in prison and I got hit on a lot, but it's a relationship dead end. So I don't recommend dating your patients, especially if they're inmates.
I feel like it's bad when the elderly patients are like, oh, how old are you? Are you married?
Yeah.
Like I have a great grandson. That's perfect for you.
Never have I ever laughed at a patient.
Sorry.
I've never laughed at a patient. It's more like something happens and then you leave the room and you're like, oh my God. Like I've had a patient fart while I'm trying to do a rectal tab.
I think that's a really bad thing, but I have laughed with them.
Okay.
One time, the patient was getting ready for surgery. He had Charcot, you've seen that, right? Mm-hmm. And the other nurse asked him like, oh, do you know why you're in here? And he goes, yeah, hysterectomy. And all the nurses started laughing so hard because he was just f***ing with the nurses.
Never have I ever had friends ask me for medical advice.
All the time.
All the time.
All the time.
Every single time. That's kind of normal.
Yeah, and I think it's also because I work in the ER, so it's like, oh, she knows everything. And it's like, hey, I have this weird bruise, or my kid has a fever, and then you're like, oh.
I've had friends too with babies and they're try asking me things and I'm like, I don't work on a NICU, a neonatal, I don't work on pediatrics, I work on elderly adults. I don't know anything about children because I haven't had any yet.
I don't really mind. Once we get to the topic of, do I have hemorrhoids? I'm like,
yeah! I'm also a comedian, so I have poor comedians send me pictures of rashes that are 7 inches away from their and I'm just hey bro, not a dermatologist, but that shit looks inflamed. Never have I ever thrown up at work.
I actually have not.
I have.
I have too.
I was at work and somebody got gassed. Gassed is when you mix urine and feces and scrapings from metal bars and throw it to somebody's face. Yeah. Guess what happens when you mix urine and feces together and metal scrapings? What's the first thing you do? You try to get it off. And you have shrapnel in there. Yeah.
Sediment, gross.
I once had a patient that came in with osteomyelitis, diabetes, horrible vascular system, and he had maggots in his foot. And I said, excuse me, I have to go. And all my breakfast came up.
Never have I ever napped on the job.
Yeah.
I have not.
The night shift for our break time, our lunch time is not really for eating, it's for
napping.
Yeah.
For us, it's 8 p.m. to 8 in the morning. So 2 to 4 is that weird do I need coffee? No, I'm gonna take a little quick nap.
Yeah.
It was my second night shift, and I did it for 10 minutes. And someone woke me up get the f*** up. It was the dementia unit.
Okay.
Yeah. I worked at an old people Jewish home and they're like, you can't sleep here. And I was like, all right, fine.
Never have I ever slept through a shift.
Not through, no, I cannot say.
No, I'm not.
Nope.
I think
that's impossible.
I think that'd be kind of hard because the nurses work 12 hours.
Yeah.
So You gotta be real tired.
Or hungover.
Or hungover, yeah, that's not ever good.
Never have I ever had a patient pretend to be sick when they actually are not.
ER.
People come up, they're like, I'm having chest pain. And you're like, okay, let's, and then you have a line of people. There are people that are like looking at everybody like, oh my gosh, okay, take care of that person, because then you look like the bad person.
I think it's also, because I've never worked in ER, but like on discharge, doctor's like, you're good, everything's checked out. And they're like, well now I just don't feel good. Like I don't feel well enough to go home.
Oh, yeah.
And you're like, what's going on? Give me a symptom. What's hurting? I just don't know. It's everything.
Yeah.
Everything. And you're like, okay.
I get it, no one wants to wait, but you don't have to lie about what you're feeling because it just makes you look bad.
It's always the elderly patients that are like, I have a headache. And I'm like, really? Because we did a CT of the brain last night. It doesn't look like anything. You look great.
And you're like, a headache, you can go home with that.
Yeah.
We all have to have those.
You can go to the nursing home. But no. Never have I ever ignored a call light on purpose.
Yeah.
Yeah.
Dude, every time. What about you?
I plead the fifth.
Sorry.
But it's those patients that call, and I don't think anyone else realizes this, like they call every 2 minutes.
5,
You
10.
literally like on the call light, on the call light, on the call light, and you're just like, okay, I was just in there. I just walked out of the room. Like I have other patients. There's no way they need something.
I'll peep in. For the most part, I peep in. How can I help you? Well, for the most part, if it's, you're busy. Because sometimes it's silly things like, can I get a straw? And you're like, okay, I'll get you a straw.
They think it's like room service. That's what they see it as. Like, you're my personal slave for the day. And it's like, no, I'm really actually here to do a bunch of other things.
Here's my politically correct answer. I have never ignored the call light, but I have prioritized it for a later time.
Look at you! Dang, okay, you win. I'm the bad nurse, like, no call light. I think nursing in general is such a rewarding job that, no matter what happens, you're always gonna be nurturing and giving and you're gonna wanna help. Some days are definitely harder than others. There are definitely patients that are easier to work with and more difficult to work with.
I think the best thing is like, honestly, treat your nurses with respect. We're doing our jobs, and yes, we deal with a lot. So honestly, just treat us nicely and we will be literally the nicest people back to you.
For future nurses, I hope we didn't scare you. Nursing is a very rewarding profession. It's a great job to have.